My name is Marty Melville. Let's talk about tools we can use as healthcare providers to assess risk for suicide. The first step in effective suicide prevention is to identify everyone who needs help. The Columbia Protocol was the first scale to address the full range of suicidal thoughts and behaviors that point to heightened risk. This protocol can be found online through the Columbia Lighthouse Project, specifically on the page About the Protocol 2024. This protocol serves as a detailed guide that helps to quickly triage and identify suicidal risk for the patient with suggested interventions based on the severity of the findings. The SAFE T card guides clinicians through 5 steps which address the patient's level of suicide risk and suggests appropriate interventions. It is intended to provide an accessible and portable resource for the mental health professional whose clinical practice includes suicide risk assessment. Available through the U.S. Department of Health and Homeland Services website, 2009, this guide gives detailed lists of possible findings with recommendations based on severity. The client in the case study provided demonstrated several suicidal risk factors identified in the Columbia Protocol, the SAFE T card guide, and in the general risk factors for suicide listed in Table 9.2 by Trenoweth et al., 2017, pages 128 through 129. These risk factors include the following. The patient is divorced, lives alone, is unemployed, admits to recent increased alcohol abuse, admits to depressed feelings, insomnia, and poor appetite. He states, quote, he wants to die, end quote, and has had suicidal ideation for the past week with a planned and enacted overdose of alcohol mixed with Valium that brought him to the hospital. He denies hobbies, activities, friends, or any close relationships, including family. He states that he views death as, quote, freedom, end quote. The client has a history of previous suicide attempt and was treated with ECT therapy with improvement for 2 years post-treatment. He states he quit school early to support his family but has been unable to sustain a job for more than 2 years at a time and was usually fired from his job due to his temper. He states he worked as a physical labor. The client states he has no financial resources. He was given a bad conduct discharge from the Navy with a history of violence and disobedience to his superior officers. He has several arrests on record for public intoxication. Again, the client states he, quote, wishes he were dead, end quote, without statements of wishing to hurt others. The assessment tools used are detailed enough to complete a triage of this client's suicidal state. Had the patient presented to healthcare professionals for help prior to his suicide attempt, the C-SSRS assessment tool would have been the most efficient tool used to determine his risk level and the next immediate step required to assist him. Given that he was already admitted with the suicide attempt made, the SAFE T guide is excellent for gathering detailed information on his possible continued risk and why that is so, along with suggestions for interventions and assistance going forward. Additional information that would have been helpful on this case would include access to previous history from medical professionals who worked with him in the past. In addition, any medical history from his primary care provider identifying physiological illness or injury would equally be beneficial in painting the big picture for this individual. As medical professionals are trained to recognize suicidal ideation and utilize the guide cards mentioned above, the hope is that intervention may take place at an earlier point in time for these tragically distressed individuals. Thank you.